Hi, good evening. Austin Mayor Steve Adler. We got a minute. We're going to go over the virus numbers here pretty fast, pretty quickly. We have Dr. Escott's slides because it's Tuesday. We'll go through those as well. Festive day here. I just had my my two grandchildren, Remy and Asa, come by with cake. We had cake for dinner to celebrate my birthday. Celebrated my 65th with having gotten the vaccine yesterday. More people are eligible now for vaccines, so we'll talk about that in just a moment too. But we're going to begin the conversation, as we always do, with looking at the key indicators, which is what Dr. Escott looks at when he's setting risk levels. And here they are for people to see. You can see new admissions are 20 in the hospital. 7-day moving average is 22. It's these yellow numbers that we use to set the staging. It's served us pretty well to avoid the overrunning of our ICUs and to also keep the community safer than most. 20, 7-day moving average is 22, so we're below the 7-day moving average, but it's been several days in a row that we've been at 22, so we've kind of leveled out. We were decreasing. You can see on the chart, the numbers here at the end seem to be leveling out. 317, 20.7, 18, 22, 319, 21.4, 21.7, which is 22 on 320. 22 on 320, it was 22. It's continued that way on 322, and then here on 323. New cases 64, that's a good sign. Cases down, lower than the 7-day moving average that we have. Positivity in the city, last week it was 4.3%, going up to 4.4, so that's kind of leveled off too. Everybody's concerned about what happens in the week after spring break. If you went away during spring break, please try to isolate. Give yourself 7 days. Take a test at the end before you're out among people here, especially if you were in an area with a higher positivity rate than what we're looking at in Austin. Let's take a look at the other dashboard that we look at. This is the one that tells us how many people we actually have in the ICUs. Been less of a concern here recently than it's been in the past because the numbers have come down, but just so that you can see it. 154 are hospitalized, 163 is the 7-day moving average, so we're below that. 62 in ICU, 7-day moving average is 58. We're just above that. Ventilators 37, 2 above the 7-day moving average of 35. Again, kind of leveled off numbers. I mean, that seems to be the overall theme. Deaths 803 yesterday, day before it was 802. So we had an additional person pass away. This death mortality rate in our city, in our county, it's about 803 people out of a universe of 1.3. So you could, 1.3 million. So you could take this 803. We have 13 groups of 100,000. You take 803 divided by 13, and you end up with roughly 70, which is generally speaking where the number is for mortality rate per 100,000. And Travis County, one of the lowest in the country, and the lowest in the state. But we'll see that in a second when we look at Dr. Escott's numbers. Let's go ahead and take a look at those numbers. We'll go through his and Director Hayden's files. Let's see how quickly we can get through those numbers. This was the report that we got from him today. You can see this is new cases. We were up last spring into July. This is really the July surge, came back down. This is the surge that happened right after Thanksgiving into December, and then January. This is Thanksgiving, started to rise. We peaked, as you recall, in January, really got serious about masking, and discipline number came back down. You can see how we've leveled out here just toward the end, having continued down. New admissions, you can see the yellow line is the 7-day moving average. You can see again here on the right where the number is leveling off. Next chart shows you blue line is hospitalizations, orange line admissions in the ICU, gray line is ventilator use. Numbers all coming down, but when you get to ICUs and ventilators again, leveling off. This is the most recent model from the University of Texas. You can see that it's projected relatively flat, but we're getting relatively low. This is admissions into the hospital. This is the total hospitalization number. If we're not careful, there's still, a chance that we could spike. But right now we need to keep wearing masks. As long as we keep doing that discipline, we all feel that we're going to be able to continue to open things. But we need to wear masks even after you've gotten a vaccine. Here's ICU patients. Historical trend. This is what I was talking about with mortality rates. These are mortality rates. How many people have died per 100,000 population? Number at the top is El Paso County, about 300 people per 100,000 in that city, county, El Paso County, have passed away. The line below that, Bexar County, which is San Antonio, number of deaths per 100,000. This is the next line is, this is Lubbock. Sorry about that, Lubbock. And then this line is Bexar County, where San Antonio is. The blue line is Dallas County. Harris County is the gold line. And here at about 70 deaths per 100,000 is Austin. The average in the state, by the way, is about 160. So Austin's mortality rate, less than half of the mortality rate, average mortality rate in the state of Texas. That's something that we should be proud of. That happens because of the decisions that we make as a community. So while generally speaking, trends have stayed the same, when peaks happen and peaks don't happen, the difference in mortality between Travis County and the rest of the state and the state average, we're less than half of the United States average, one of the lowest among cities in the country. We have to thank Dr. Escott and the Austin Public Health team, the city staff, Travis County staff, but then everybody else, all the volunteers, all the providers, all the people that are being disciplined and making individual decisions to wear masks. If we were at the state average, we would have 1,100 more people pass away than we have seen pass away. 1,100 more people if we were just meeting the state average. This is a community that cares about one another, and it's demonstrated by what we do. Let's continue on here. This is taking a look, by the way, at counties in our area. You can see here is Caldwell County, much smaller than we were, but this is the mortality rate. This is Bastrop County. This is Hayes County. And here you can see Williamson County and Travis County virtually on top of one another, both about 70 per 100,000 people. This is hospitalizations by age group. Remember, it used to be that we had 4 distinct groups. The people 50 to 59, 60 to 69, 70 to 79, and over 80, all 4 moving together, separated from those that are kind of in the middle ages. What is this? This is 20 to 29, 30 to 39, and 40 to 49. But you can see that the percentage of hospitalizations of the older groups are coming down. And the percentages of the middle group going up. Total number of cases are going down. You can see just a month ago, here's February 22nd, a month ago. Highest age group going from 25 to 21, 42 down to 30, 50 down to 31. And the blue group, 51 to 28. These are the groups most probable getting vaccination, and the people that are most protected used to be the most vulnerable. And you can see what's happened to these numbers. You get down to the lower age groups, 50 to 59, the folks who were not in that first group to be tested. Then 23, this is 40 to 49. It went from 23 to 18, 18 to 21, actually an uptick in the 30 to 39 range. Yellow, 20 to 29 age group goes from 20 to 14. Below that, very small. A lot of this, I think, is because of the vaccine and how we're continuing to vaccinate the population. Here is hospitalization by race and ethnicity. This is the lowest number. The green line is the Hispanic, all races number, down at 32.6, below the percentage that this community is of in our population. This is in part a really concentrated effort to make sure that we're trying to get as many people, and it's a lot of people in the community stepping forward to help. There was a vaccination clinic at one of the churches on the east side, gave out the vaccinations to 1,500 people plus or minus. Maybe a lot of people that wouldn't have otherwise gotten the vaccination, thanks to Frank Fuentes and his folks. But as this percentage goes down, percentage rises in the white population up to 51.8, about what that population is in the community. The one number here that is of real concern is the African American number, going from 8.2 last week to 12.8. They're also talking to some of the faith-based organizations on the east side of town to try and set up vaccination clinics there as well, to make sure that they're going out to that community and from people that are trusted in that community. Here's race and ethnicity by hospitalization, same kind of number you saw before. This is Hispanic, all races in green, a month ago, 87, a total number down to 46. White, not Hispanic, from 84 to 73. African American population from 35 to 18, so the numbers are good. But it's of a smaller group, the 141 versus the 220. Here's positivity by week. We were up high not that long ago, 16.7, now headed back down. We were 4.3 last week, 4.4 this week. What we really wanted to see was this number dropping and getting below 3. So the fact that it's plateaued out of concern. We'll really know a lot more about spring break the end of this week into next week to see whether or not it looks like there's a chance of a surge. This is by race positivity, just another way of looking at that chart. All of the positivity numbers went down except for Black African American. That's the concern I talked about before. Everybody else's numbers went down. Here's positivity by age group, roughly the same kind of numbers that we were seeing last week. The number 10 to 19 went up ever so slightly. 50 to 59 went up ever so slightly. Positivity in school-age children, the numbers continue to come down. There's high school, middle school, and elementary school and preschool. This is a significant chart. This is the nursing home and extended care chart. I'm trying to find what the numbers were here. I'm trying to find the notes from the meeting today. But you can see that with 6 days left, let me see if I can find this chart. for you. I want you to see what the numbers were just a month ago. In the last 14 days in our long-term care facilities, we had 6 new cases. And in the last 28 days, 20 new cases. And I just wanted you to see those numbers are so much lower than the numbers were, same numbers on the same chart, but a month ago. See if I have those. Because it's an impressive number that I want you to be able to see. But a month ago, these numbers were many-fold higher than what they are today. And I thought I had those numbers written out for you here, but I don't see them. I don't see them right now. But the number here, I think 6 was in the last 14 days. Was over 100. In the last 28 days, it was over 600. This is the group that was really the most susceptible that we have in the community. And with vaccinations and care, those numbers just way down. Those are the most vulnerable and the people that were most likely to pass away. We still have the folks for the fusion care. That's the treatment that the President Trump got. It's available to people in our community. If you get the virus, if you're early in a candidate, you should always ask. We've closed down the facility at the Austin Convention Center because we don't have the demands that we had on our hospitals. Influenza numbers still staying below 2%, which was the goal that we set. At 22, we're still right in the middle of stage 3. We have to get it down below 10, and that'll get us into the blue area, an area that we have yet to achieve since we entered into this a year ago, but something that is achievable for us, even as we expand some activities. That's still achievable for us if people continue to wear masks and distance. Behaviors: wear a mask, avoid clumping with people more than 10. If you go to a restaurant, make sure you don't sit at a table with more than 10 people. Businesses, we're asking to operate at reduced capacity despite the state order if you can. It is a safer thing to do, so that's what Dr. Escott is asking. With respect to vaccines in the community, Austin Public Health, as you can see here, total doses administered, 129,438. The number of people that have gotten the vaccines is about 60-70% of the vaccines that were given are people over 65. This does not include the CODA. Travis County, partnering with the city of Austin, has given out about 40,000 vaccines in that area. Total, 148,844 total vaccines. That's not with CODA. CODA is about 40,000 on top of that. We saw that this past week, it was open to 1C, people over 50. We see that the state this week has opened it up to virtually anybody now, but we've been told that we can continue to really give priority to the 1A, 1B people. So anybody can sign up at this point. If you're not registered, you should register. On Mondays is when we go and you can go sign up for an appointment. Not everybody who wants one will get one, but you have to get in line. There's a queuing system that tells you whether you've gotten in or not and how long you need to wait. If you got in before they come back to you, you can see the number of people ahead of you decreasing over time, and you can judge that for yourself as well. It's a process that works. But Austin Public Health and the county will still, in their smaller clinics, in their outreach with the nursing hotline, which we have. For people who don't have computers, can't get on that way, we actually have a nursing line that will register people over the phone and help them go through the vaccine appointment process. We even have Cap Metro and others giving free rides to people to get appointments. Meals on Wheels is working with Austin Public Health to give vaccine to the homebound that they work with. On Monday, I get to participate in that with one of our retired judges in the city. And I'm going to go visit her and be with her when she gets her vaccination. I'm excited about being able to do that. APH, as Austin Public Health, has vaccinated over 10,000 school and child care staff. And here we see first dose, 51,000, second dose, 25,000, 76,000 shots given to people 60 years and older. We piloted this past Saturday, giving vaccines out at the Burger Center drive-through, gave vaccines to 1,440 people. That has the capacity to do 3,000 a day. We're hoping to get some more supply. We can give out thousands more a day at COTA if we were just trying to get the supply. And we're told that probably mid-April, it's really going to ramp up on the supply that's available. But we can give out more at Tony Burger Center. We can give some out at the Expo Center. We're also giving them out at smaller facilities and operations in order to be able to really target and get to the people that are hardest to meet. This is the Meals on Wheels partnership that I talked about just a second ago. The interface, as I talked about, is being worked on. This past week here, I know last week we had some glitches, weren't any glitches last night. I got on and was able to get an appointment. In development is an even more friendly user site and greater interactivity. So those are the slides from Dr. Escott. I'm excited that there's more vaccines. I'm excited that everybody gets to sign up, but I'm excited there are organizations like Austin Public Health that are still really going to stay as focused as the state law allows us to be, to make sure we're getting the vaccine to the folks that need it the most. And again, remember that most of the vaccines in our area are not being given out by Austin Public Health. So there are lots of other places for you to be able to go to get the vaccine. Here's a website, centraltxvaccs.org/hubs.php. Some of my colleagues were able to get sign up for a test and go take it in Georgetown, which is actually not a bad thing to do. You should get whatever it is that is the first shot that's available to you, and that is the one that is best, the one that is available to you. I want to close for a second talking about homelessness. Today they convened a plenary session on homelessness. This is a summit that's going to be a weeks-long interactive and multi-part kind of virtual conference. It's gathering together a diverse coalition of community advocates and leaders and service providers and business group and philanthropists, leaders in all different organizations, governmental, not governmental, all coming together in this weeks-long interactive and multi-part virtual conference. What they're trying to do is to identify two goals. One is to identify with timetable and criteria, what would a program look like to actually end homelessness? And by ending, I mean reaching equilibrium, so that you get to a place where as you're people go into homelessness, experiencing that at the same rate that you're able to house people, that equilibrium place. But also as a second goal to really do something about the immediate issue of camping and encampments that people see. I'm really excited for this process. I think what we've learned is that in order for this to actually work, it can't be something that's city-led. City doesn't control enough of the levers. ECHO, which is the umbrella organization, gets the federal funding for homelessness in our area, is separate from government. But it doesn't control enough of the levers. Organizations like the Housing Authority gets the vouchers from the federal government, but it doesn't control enough levers to do it by itself. This is the organizations that do the support, like Caritas and the Salvation Army. Those are independent, separate organizations. Wouldn't it be nice if everybody was working together? And it's going to take those organizations really coming together to identify those paths. And I'm really excited to see what comes out of this summit over the next couple of weeks. It is a comprehensive group of advocates and leaders. They've come together to agree on that unified implementation strategy, focusing here on unsheltered homelessness in the city. I'm excited because this is the first time we have ever had arm in arm working together. The Chamber and the DAA, Downtown Austin Alliance on one hand, and the Austin Justice Coalition and Homes Not Handcuffs, organizations that for years have been unable to see eye to eye on how we should proceed on this challenge, are now rolled up their sleeves and locking arms. And I'm real hopeful that they're going to bring us a plan that everybody agrees on. I'm hoping that the summit gives us a new and a different approach toward meeting the challenge of homelessness in our city. My personal belief is that moving backwards by criminalizing homelessness, by giving people tickets or arresting them or sending them back to the woods or the streams is not the right solution. I don't want to go backwards. But we're hoping from this summit that we can have a new way, a new direction, new solutions, different than what we're doing right now. So we can get folks out of camps and out of tents and off our streets. And I'm excited to see what's going to come out of that. I know the council met today looking at the sum of money that's coming to the city. A big chunk of change coming, almost $200 million, about $200 and almost $250 million coming to Travis County. And the question was asked is, what if we didn't do what we did before when we got the first money from the virus? We were putting tourniquets around open wounds back then, taking care of the immediate injuries that were all around us. What if as a community we took a step back and said, let's kind of pool all the money. Let's not try to spread it thinly over the 100 things that we could help. But what if we focused on 1, 2, 3, a small number of challenges and really focused on them with funding that would really give us transformational and generational change that might be able to enable us to move off the plate challenge that we've had for years. That's a conversation the council will have at our meeting on Thursday as to whether we ask the staff to go away, talk to Travis County, and come back to us with what that kind of option moving forward might look at. It's one I support, one I want to see. With that, I think that's all that we have here tonight. You all take care and be safe. Good night.